Namaskar dosto. Good afternoon. So friends, my today's topic is going to be very interesting. It is about something which is very important for all of us to understand that why blood sugar test is very important for us when we actually age. In fact, you must have seen that there are a lot of young diabetic patients who are coming into picture, and because of the uh, you know growing in acceptance of the western food, the junk food, people are into taking a lot of carbonated drinks and junk foods along with the pizzas and burgers. So all these things, are they really so very important for us to accept as a changing western culture? That is that we need to understand, because at the end of the day all these things are directly and indirectly influencing our health and are actually contributing in terms of giving a lot of dent to our health. So without any further ado, let us directly jump to why we need to focus on our regular blood test. I would like to start this presentation, in fact this whole content, with a story that will hit many homes including yours. So let us start. So let's start with the story. What happens is, one that might be more common than you think usually. Yeah. So what you will have to do is, you will just picture this, imagine this, that you are in your mid 40s and living a very normal life. Yeah. So you don't have any kind of health issue, nothing to out of the ordinary is there. You feel very fine, you are quite comfortable with your health. But maybe you have noticed that some small things, you feel a bit more tired than usual. You starts remaining thirsty all the time, and you need to use the bathroom very often, more than normal. But life gets busy and you just brush it off. You just say that, let us ignore it. So I'm just repeating those symptoms which you have started feeling, but you have actually ignored. You are into your mid of 40s and living a very comfortable life, but because of these symptoms which remain unnoticed and you have given no importance to these symptoms. What are those symptoms? That you are usually more tired than usual, you are more thirsty than usual, you need more time in the bathroom, you go very often to the toilet, and still you have not given a due consideration to this particular problem. So what happens, friends? Month later, during a routine checkup, your doctor asks you that when was the last time you have had your blood sugar checked, because you went for a normal checkup because you felt that something is going to be a bit wrong, you are not comfortable the way you used to be. So you went to a doctor, and doctor asked you when was the last time you had your blood sugar checked. Then you definitely will recall and try to remember, but you are not in a situation to recall because you never had any kind of blood test. So then what he did is, they ran a quick test, and then the doctor delivers the news to you that unfortunately you have diabetes. The shock hits you. You think, I felt fine all the time. How could this happen to me? My dear friend, this is not a story of yours alone. This is a story of millions of people around the world and are living right now. Most of the people, including me, you, and everybody, we feel that we cannot have diabetes. We cannot have, blood sugar. I'm very comfortable. I'm doing my, routine things in a much comfortable manner. How can I have diabetes? So this is the same story of many people, millions of people across the globe. In fact, did you know that 1 in 2 adults with diabetes are underdiagnosed? I'm repeating, 1 in 2 adults in with diabetes are underdiagnosed, and that's over 240 million people who have diabetes, but they don't know it. It's a very hard statistics. 200 million people means nearly 24 crore people across the globe. They have diabetes, but they are not aware about it. That is the statistics I'm sharing with you, because this is a global data, this is a global prevalence which I'm sharing with you. Unfortunately, you can see that people have given no kind of consideration to this, and they're just ignoring it. Unfortunately, you could be one of them. So that is why my today's topic is why we should be going for a regular blood sugar test up checkup, even when we are after, we have crossed the age of maybe 35 or 40. So stick with me until the end of this video, my dear friends, because what I'm about to share could make sure you are not one of those people. If you are going to there with me till the end of this particular video, my dear friends, because what I am about to share actually could make sure that you are not one of those people, because the symptoms which I will tell you, you will have to map those symptoms with you. Probably if those symptoms you are finding in yourself, you could be either pre-diabetic or a diabetic. So be with me till the end of this particular video. You could find a lot of interesting things, you could find a lot of informative facts which could help you avoid a dangerous and silent problem before it's too late. Because usually hypertension and diabetes, these are metabolic disorders, they are lifestyle disorders, and people come to know about these disorders when they have already got into a moderate stage of it. So what if I told you that the symptoms which you can pre-analyze, and you can just reevaluate that whether you have those symptoms in you or not, so that probably in case if you are one of those candidates who are probably pre-diabetic, actually can this video can help you understand and find out whether you are actually in the process of landing into that disease or not. Now, the first section of this particular video is the very important question: why regular blood sugar tests are life saving? Because most of the people are saying that why should I go for a blood sugar test, because I feel very normal, I feel comfortable. Even if you have no symptoms, even if you are normal, if even if you are comfortable with everything, I still would recommend all of you, if you have crossed 35 40 years of age, you must go for a regular blood sugar test, because it is going to save your life. Because diabetes and hypertension are chronic metabolic disorders, and once you are diagnosed with diabetes and hypertension, it is probably next to impossible to reverse them, because it has got only cure. You can only control them, you cannot cure them. So it is always said that prevention is better than cure. So here are a fact that might surprise you, my dear friends, and those facts are: every 10 seconds, I am repeating, every 10 seconds, someone is dying from diabetes related complications. I'm repeating, every 10 seconds, not minutes, my dear friends, mind it. Every 10 seconds, someone in the world is dying from diabetes related complication, but many of these deaths could have been prevented with early detection. Unfortunately, in countries like India, where we don't have that kind of setup, people are not aware about those kind of complications. They have no feasibility for the regular test. So it becomes very very important for you to understand the importance of diabetes, and what the importance of diagnosing diabetes or the symptoms, catching these symptoms early, for you to manage these very dangerous disorders effectively. So why are regular blood sugar tests so very important? Here lies the answer of it. It's because diabetes is a silent killer. You will never come to know that you are diabetes till you land into complication. It is a silent killer, my dear friend. Once it gets into your body, it will try to rust you the way water start rusting iron. You might feel completely healthy while high blood sugar is silently damaging your body. You will continue to feel that nothing bad has happened to me, I don't have any kind of symptoms. Still, if you have mild to moderate incremental sugar in your systemic blood sugar, then probably you may have problem in the later part of your life. The longer it goes unchecked, the more dangerous it can be, because it is in the early you diagnose it, the better it will be for you to control. Diabetes is something, the more fast you catch hold these symptoms, the better it will be for you to understand and get into the root cause of it. So routine blood sugar test can catch the problem early, and here lies the importance of these routine blood tests, because these routine blood tests are going to find out, going to help you catch these symptoms early in the early phase of your life. And catching it early means you can take action before diabetes causes any kind of serious harm to you. Diabetes is something which can actually cause a lot of macro and microvascular complications. When it comes to macrovascular complications, my dear friends, I am talking about stroke, that is called as brain attack, or heart attack, or other kind of complications. And when I'm talking about microvascular complications, I'm talking about nephropathy, neuropathy, or uh, you know uh, retinopathy. So when I say retinopathy, I'm talking about damage to the eyes. When I'm saying nephropathy, I'm talking about the damage to the kidneys. When I'm talking about neuropathy, I'm talking about the neurons of the body. So there are certain symptoms which I will tell you, my dear friends. Please stick to my video, because in this video I will tell you all those initial symptoms which probably you may or you may not have, or many any of your family member might be having that. So you can help yourself, you can help your family member in order to diagnose early this metabolic disorder. So if you think this is something you can ignore, here's another staggering fact. Because I tell you, my dear friends, more than 1.5 million deaths each year are directly caused by diabetes. Which means what? 15 lakh deaths each year are directly caused by diabetes. And so it becomes very, very inevitable and essential for any and everybody to understand the importance of this diabetes, because diabetes is a very, very silent killer disease, and a very, very diabetes may not be the direct cause of death for anybody, but it is always the complications of the diabetes with which the individual dies. Individual may not die with diabetes, he will die with maybe retinopathy, neuropathy, nephropathy, stroke, cardiac arrest, heart attack. These are the secondary outcomes of diabetes. So understanding the danger, understanding the importance of what diabetes is, it becomes very, very essential and important for all of you to understand those symptoms of this particular chronic disorder. So let me tell you, my dear friends, to truly understand why blood sugar tests matter, let's break down what diabetes is and why it is dangerous. Because if I'm why I'm focusing on you to go for regular blood sugar tests, because this is something which is the prerequisite for you to actually understand whether you have landed into the complications or landed into the problems or not. So let's break down what diabetes is and what its dangerous complications are. If you understand that, probably you will be able to manage it highly effectively. So what is diabetes? Diabetes actually happens when your body cannot use insulin properly, causing your blood sugar level to stay too high. Over time, high blood sugar affects every part of your body, and eventually you land into complication. My dear friends, diabetes means doesn't mean that if I take your blood sugar after you have taken your meal, or if after you have taken a lot of ice cream or sweet dish. That is not the way to calculate diabetes. It is diabetes is actually the continuous or prolonged, or the at any given point in time, if your blood sugar level is higher than the normal standard range, then you are either pre-diabetic or a borderline diabetic or a diabetic. So diabetes happen when your body cannot use insulin properly. Insulin is basically a hormone which is secreted from pancreas. Pancreas is one of the most important organ in your body. So this insulin is the one which is responsible for actually controlling sugar in your blood. It transports this sugar to different parts of the body and will not allow this free sugar to circulate in the blood, so causing your blood sugar level to stay too high if you have diabetes. So over time, my dear friends, high blood sugar affects every part of your body. And let me tell you which are those parts which are going to be affected. The very first is heart and blood vessels. High blood sugar can damage your arteries, leading to heart disease. People with diabetes are twice as likely to have heart attack or stroke compared to those without it. So very hard to know, so very hard to understand. And this comes into macrovascular complications. So when I talk about the consequences of diabetes, my dear friends, I'm talking about the macrovascular complications. What are those macrovascular complications? The macrovascular complications are going to be for the heart and blood vessel, because high blood sugar can actually damage your arteries, which is actually causing you to land into heart diseases. And I've given you a statistics that people with high diabetes are twice as likely to have a heart attack or stroke compared to those without it. So possibly, if you have diabetes, your possibility of landing into stroke or cardiovascular complications is going to be doubled up when you have diabetes along with the other comorbid issues. Next is the kidney. Kidney damage is something which is one of the most important organs for us to filter our blood. Kidney is the organ which is responsible for filtering our blood and continuously throwing the waste material out of our body. So your kidneys filter waste from your body, and high blood sugar can damage these kidneys, because these kidneys will lead to kidney failure. In fact, diabetes is the leading cause of kidney failure worldwide. If you ask any diabetologist that what is the leading cause of kidney failure, they will probably rate diabetes as the number one killer. Diabetes is the one is actually the cause for putting continuous pressure on the kidney, and kidney lands into problem. Then it becomes kidney failure. This is called as mild renal failure, then it comes moderate renal failure, then it comes severe medial renal failure, and the last stage is called as end stage renal disease, which is called as ESRD. And in those stages, severe and ESRD cases, the only alternative left is your dialysis. So you must have seen people going for dialysis, and these are the people whose kidney is actually moderately severe or even ESRD stage has actually arrived. So what is the role of our kidney? The role of our kidney is to filter the waste from our blood, and high blood sugar can damage these kidneys, leading to kidney failure. In fact, diabetes is the leading cause of heart kidney failure across the globe. Then comes our eyes, that is called as retinopathy, which is leading to vision loss. So diabetes can actually damage the blood vessels in your eyes, and those blood vessels are very very micro in nature. So that is called as microvascular complication, leading to something which is called as diabetes retinopathy. So diabetic retinopathy is a disorder where there is a pathy, damage of the retina, which is the area from where your image is formed in the eye, and that is how you are able to see. So if there is a pathy, there is a damage to this retina because of the lack of blood supply, what is happening? Because of the crystallization of the inside that microvessels, you probably may not have blood supply, and you will have gradual decline of the visual power. So if left untreated, it can cause blindness. So friends, diabetes is one of the leading cause for causing blindness as well. Today, diabetes is one of the leading cause for not for the blindness, but for all macro and microvascular complication, specifically in working age adults. Then the third microvascular complication is, my dear friends, that is called as nerve damage. High blood sugar can actually damage your nerves, my dear friends, because especially in your feet and hand, and leading to pain, tingling sensation, and even loss of feeling. Many a times you might have seen your mother or father, or even you might be feeling, or your spouse might be feeling that some ants are actually moving below the feet. So that is called as tingling sensation. So always remember, my dear friends, that high blood sugar can damage your nerves subtly and slowly. That is why it is called a silent killer, especially in your feet and hands. This leads to a lot of pain, this leads to a lot of tingling sensation, and even loss of feeling. So in extreme cases, my dear friends, the last option, the last treatment for treating this is amputation. Now let me tell you what is amputation. Amputation is called as cutting that particular limb. Probably doctor has got no option left rather than cutting your leg. That is called as leg amputation. So these are the complications diabetes can cause if remained untreated. One more statistics I will tell you, my dear friends, that every 30 seconds, I am repeating, every 30 seconds, someone in the world is losing a lower limb due to diabetes. See the statistics. Every 30 seconds, somebody's leg is being amputated. That is the kind of the killer this disorder is all about. Now let me get into the next part of my presentation, that is why you should get tested, and why it is very very inevitable, essential, and very important for you to to undergo your diabetic blood sugar test. Even if you are fine, even if you are feeling no kind of diabetic symptom, still I would recommend, if you are 35 or 40 years of age plus, you must go for your blood sugar testing regularly. And there are again some statistics, and those statistics are not normal statistics, they are very shocking statistics. And let me tell you, more than 80% of people with pre-diabetic, I am repeating, more than 80% of the people with pre-diabetic don't know they have it. Which means for you to be in this pre-diabetic or a borderline stage is very very high probability, if you don't have proper sleep, if you don't have proper diet, if you don't go for exercise, if you are overweight, on top of that if you take alcohol, or you are a smoker, or you live in metro cities. So probably such kind of requisites are going to add to making you pre-diabetic. So pre-diabetic is when your blood sugar is higher than normal but not high enough to be classified as diabetic. But this disease starts from only pre-diabetic stage. Once you become pre-diabetes, your possibility to transform from pre-diabetes to diabetes is very very high if you continue to stick to the same schedule which you are doing it currently. So without lifestyle changes, people with pre-diabetes, they are likely to develop type 2 diabetes within 5 years. I am repeating, if you are diagnosed as a pre-diabetic and if you don't control, the possibility for you to develop type 2 diabetes within 5 years is 100% confirmed. I am repeating, if once you are diagnosed as pre-diabetic and you don't take care of it, you don't take it seriously, the possibility for you to land from pre-diabetes to diabetes, type 2 diabetes confirmed, is 100% within 5 years. So imagine having the chance to stop diabetes in its tracks. So this video is going to tell you about catching the symptoms of diabetes, the importance of early, catching the diabetes and going for blood sugar tests regularly becomes very, very important. So all because you took a simple blood test. What I'm saying is, what I'm emphasizing is on this video is, you will have to go for a simple blood sugar test, probably, pre-fasting, pre-meal and post-meal. So that simple test can is sufficient enough to give you some clue whether you have this borderline disorder, you are into borderline disorder, you are pre-diabetic or not. That is why when your life is quite stressful, when you're eating junk food, and your life is sedentary, you don't do exercise, and you live in metros, so for them, for a person with all these symptoms, I think it is very very essential for you to go for checking your blood sugar and doing your blood sugar testing at least once in a quarter or once in 6 months. Even if you feel fine, getting tested is the only way to know for sure that you have diabetes or not. Even if you feel absolutely relaxed, even if you don't have any symptoms, but still you must go for getting your blood sugar tested after at least every 6 months if you have crossed 40 years of age. So it's like checking your car's engine. The car might be running smoothly now, but if you don't check the oil and keep it with maintenance, it could break down later. Without any maintenance, without looking into your car, engine oil and all those aspects, if you continue to rely on the average of the car, probably you are missing something. So it can break down, the car can break down anytime later. So your body actually mimics the same thing, and your body works the same way, my dear friends. So how often should you get tested is my next question. Somebody will ask me that, how often we should get tested. So let me tell you, the frequency of testing actually depends upon your age and risk factor. So there's a very simple guide which I will tell you. If you are over 40-45 year of age, it is recommended to get blood sugar test and done after every 6 months or maximum in a year. You must get your blood sugar tested if you are 40-45 plus every 6 months or once in a year. But if you have crossed your age 50-55, then you must go it every quarterly. Yeah, that is how you will be able to catch this. But if you are younger than 40-45 but still overweight, then, and have a family history, one more thing, even if you are not 40 or 45, you are younger, But if you are overweight and have a family history of diabetes, then probably you should start testing an early phase of your life, maybe 30s, because for you to have genetic transformation, genetic variation is going to be very, very high. So if you have anybody in your family who have had diabetes in the past, probably even you are not 40 45, but you are overweight and have a family history, then you must go for checking your diabetes very often. So there are other risk factors which include having high blood pressure, high cholesterol, or living a sedentary lifestyle, because these are called as contributing factors, my dear friends. Having high blood pressure, high cholesterol, and sedentary lifestyle contributes significantly for you to transform from a normal person to a diabetic person. If any of these apply to you, it's better to be proactive and get tested sooner rather than later. Why I'm saying is because once you are diagnosed as a borderline diabetes or a pre-diabetes, my dear friends, it is very difficult to reverse it. And once you have got a stamp of diabetes, it is next to impossible to reverse this, because there is a only control of diabetes, there is no cure of diabetes. So if any of these apply to you, it's better to be proactive and get tested sooner rather than later. Friends, the next part is the blood sugar test. What to expect, what you should be expecting from your blood sugar test. A blood sugar test is actually a test which is quick and very, very simple. There are two common types. Let me tell you what are those two common types, my dear friends. One is called as fasting blood sugar, another one is called as postprandial. Postprandial and fasting is you have not taken anything. Doctor will tell you before the fasting blood sugar that in the night you take your complete normal meal. I'm repeating, normal meal, whatever you take every day, you take that same amount. And after 12 or early in the morning, without taking anything, even water, without taking anything, absolutely empty stomach, you will have to go to the lab and get your blood sugar tested. This test checks your blood sugar after you haven't eaten for at least 8 hours. Always remember, it will help you, show how well your body control blood sugar when you are not eating. And the same is applicable for postprandial, which is like going to the blood sugar testing after 2 hours of your meal. The second very important test is called as HbA1c test, which is basically a test which is the confirmative test. This is the test which will give you average of your blood sugar level over the past 3 months. This is the confirmative test. Earlier test of pre-prandial and post-prandial, which is your empty stomach and post 2 hours post lunch test, is still not confirmatory, but HbA1 test is 100% confirmatory, and this test will give you an average of your blood sugar over the last 3 months. It's a more comprehensive look. Let's take a more comprehensive look at your long term blood sugar control. This is the one test which will give you more comprehensive, detailed, and confirmatory confirmation about diabetes in case if you have. Both these tests are actually involved they involve a small prick of your finger, or drawing a little blood from your arm. So doctor or a pharmacist will draw a little blood from your finger or a arm. The process takes just minutes, and the result could make actually a huge difference in your life. So it's a small test but can make a very, very big difference in your life. So understanding your results, what do they mean? Once you have taken your blood, given your blood to the laboratory, let us understand what your blood sugar level will tell you. So there are certain readings, my dear friends, and these readings are latest readings. There are certain changes because of American diabetes guidelines. They have issued new guidelines. The statistics which I will share you, the figure which I will share you just now in this video are absolutely latest. I'm repeating, absolutely latest, taken from American Diabetic Association. They are saying if your normal, if you have a normal blood sugar, when is you will be termed as a normal blood sugar individual. If your blood sugar is less than 100 milligram per deciliter when you are fasting, I'm repeating, less than 100 milligram per deciliter when you are fasting, empty stomach, your this is the latest guidelines. Otherwise the old guidelines used to say 110, but now it has shifted from 110 to 100. So it is saying that you will be labeled as an absolutely normal person only if your blood sugar level at fasting stage is less than 100 mg per deciliter. and they are saying that you are going to be diagnosed as a pre-diabetic if it is between 100 to 150 25, sorry. Earlier it used to be between 110 and 225, but now it is 100 to 125 mg per deciliter. If your reading comes between 100 to 125 mg per deciliter, this means your blood sugar is high, but not high enough to be labeled as diabetes. But here's the key, my dear friend: you can prevent diabetes at this stage with the right changes. This is something which is called as a precaution. This is something which is called as an indication for you that immediately you should be taken care, you should be taking care of your diet. You should transform your sedentary life to a life filled with exercise, and you should quit, smoking or alcohol if you are taking it. So it is a stage where still possibility of for you to reverse this diabetes is very high. Once you have diagnosed that diabetes, then probably no one can help you other than medications and the doctor. So diabetes, how do you confirm that you are a diabetic patient? If your fasting blood sugar, I'm repeating, if your fasting blood sugar is beyond 126 milligram per deciliter or higher, you are probably diabetic. If your blood sugar is at this level, it's time to absolutely talk to your doctor, my dear friends, and manage your diabetes to prevent it unless it is too late. The solution, how to lower your blood sugar naturally, I will give you. This presentation of mine, this whole video of mine is devoted for you to understand the importance of getting screened, the importance of symptoms, and the importance of diagnosing diabetes early, and to lower your blood sugar naturally. My dear friends, if your test shows you have a pre-diabetic or high blood sugar, don't panic. No worries, no need to panic. You have the power to take control of your health. Here are some simple tips, my dear friends, which are natural ways to lower your blood sugar level, and they are very simple. You have not to go into something very drastically changing something very drastic, bringing some drastic change in your day-to-day life. Very easily you can manage if you have pre-diabetic. First is healthy eating. If you eat, focus on whole grains, I'm repeating, naturally how you can reverse pre-diabetes. First is healthy eating. Focus on whole grains, vegetable, lean protein, and limit foods high in sugar. Sugar is the number one poison in your kitchen, followed by salt. Sugar and salt are the two poisons, I am repeating, two poisons which are lying in the shelf of your kitchen. Eating more fiber rich food will help you keep your blood sugar in check, and sugar and salt cut will give you a significant improvement both in diabetes as well as in controlling your blood pressure and hypertension. The second most important thing, apart from the first one, which is your healthy eating, the second most important thing is exercise. When you incorporate exercise as a part of your daily routine, just 30 minutes of activity like walking, biking, swimming, or doing even small yoga at your home is sufficient for you to take care of your most of the ailments. So one fact I will tell you, my dear friends, that regular exercise can reduce your risk of developing diabetes up to 58%. How eye opening it is that if you do regular exercise, the possibility for you not to have diabetes is reduced by 58 to 60%. So the first one which I told you is healthy eating, the second one is exercise, and the third one is weight loss. Friends, if you are overweight, so losing even a small amount, I am repeating, losing even a 1 pound, which is 330 grams, is like blessings. As little as 5 to 10% of your body weight can make a big difference in your blood sugar level. For example, if your body weight is, let us take the example, your body weight is 58 or 55. If you reduce it by 10%, means if you reduce your body weight by 4 to 5 kgs, if you are 55, 60, probably it is going to reduce the chances of diabetes and hypertension by 40%. That is the kind of power weight loss has in any individual. Then the next point is smoking and drinking. My dear friends, if you smoke, it is very dangerous because smoking will raise your blood sugar and increase your risk of diabetic complications. Quitting smoking and alcohol is one of the best and the fastest way to avoid any kind of complication, including diabetes. You may not have only diabetes, but hypertension, asthma, other kind of oncogenic changes. These are the things which smoking will bless you. It is not going to cut hole in your pocket, but will give you something which is going to be called as bad health. Then the fifth point is stress. You will have to focus on reducing your stress, my dear friends, because stress causes your body to release hormones that can raise blood sugar. Practice relaxation techniques like deep breathing, meditation, yoga to keep yourself stress free. And the last but not the least one is the climax that I will tell you later on. But let me give you the summary of how can you control your blood sugar level naturally and without medication. The first one is healthy eating. Incorporate grains, vegetable, protein, and limit sugar and salt. Second, exercise. 30 minutes of simple exercise every day can reduce diabetes by 58 to 60%. Then weight loss. Even 10% of your weight loss can reduce the chances of diabetes and hypertension by 40%. Then quitting smoking and alcohol, because smoking leads to increasing blood sugar level and increases the risk of diabetic complication. Then reducing your stress, because stress releases certain hormones that can release the blood sugar level in your body. And then comes the relaxation techniques like practicing deep breathing, meditation, yoga, and all these things. Now, my dear friends, what if happens if you don't get tested? That is the climax. Now I'm going to reveal to you. If you feel that I'm perfectly fine, nothing has happened and nothing can happen to me, my dear friend, I'm sorry, you might be wrong. Here's the part no one likes to think about, but it's critical. What happens if you don't get tested? Let me tell you. If high blood sugar goes unnoticed and untreated, it can lead to serious life altering complications like heart disease. You may have heart attack, you may have stroke, and for when I'm talking about heart disease, you are at much higher risk of heart attack or stroke. You may have kidney failure. You may need dialysis or even kidney transplant if you ignore this. You may be blind, because diabetes is one of the leading cause of vision loss in adults. Unfortunately, across the globe, I told you, in every 30 seconds, some or other person in the world is losing his or her legs because of diabetes. That is called as amputation, leg amputation. Severe damage to your nerves can lead to losing toes, feet, or even legs. The good news is all of this is preventable. A simple blood sugar test could save you from all these major complications. So let me give you a conclusive, note of what I have told you. So what are the takeaways, my dear friends? Don't wait. The first takeaway is don't wait, get your blood sugar tested. Number 1. It's a small step that could save your life, and the test is quick, easy, and affordable. And it gives you the power to protect your heart and your future. Friends, make an appointment with your doctor today itself, visit your nearest clinic, or get a home test done, or purchase a home test kit so that you can do very frequently testing at home only for yourself and for your near and dear ones. I'm sure, my dear friends, that this video of mine with your when you share with your loved ones will give them a lot of information that everyone needs to hear. And my final conclusive words are that you I would like to thank you all for watching all the way this long presentation. You have just learned something that could change your life or the life of someone you care about. Don't forget to subscribe and share this video to help others stay healthy and aware. Thank you very much, my dear friends, for such a patient listening and being a part of this presentation. Thanks a lot. Have a wonderful day ahead. Shabba khair.